So there are various movements: flexion, extension, adduction, abduction, internal, external rotation. There is total 6 movement. So hip joint is called the joint of 3-degree movement. Now, if we talk about the flexion, अगर हम flexion की बात करते हैं तो I have already discussed with you. The main flexor muscle is first one, iliopsoas, which is the combination of iliacus and psoas major. जो हमारी iliacus और psoas major का combination है. Then the rectus femoris, tensor fasciae latae, and the sartorius. We can see in this image also. And we can see here, they are getting nerve supply from the femoral nerve. Femoral nerve. Most of the getting nerve supply for femoral nerve. So first I would like to tell you, mainly there are 3 nerve or 4 nerve. 4 nerve हैं मुख्य यहाँ. Even the arteries who supply blood. So look at here. Who supply this part? That is femoral nerve. Because it is the femoral compartment. Who supply to the backside? That is sciatica nerve. Because it is the sciatica compartment. So here sciatica nerve. And who supply to the inner side? That is obturator nerve. Obturator. So 3 nerve mainly: obturator, femoral, and sciatica. Now this is the gluteal region. There is one more nerve here, that is gluteal nerve. So on the back side we can see gluteal nerve, who is supplying the buttock area, gluteal area, sciatica nerve, femoral nerve, and obturator nerve. So we already know sciatica nerve coming from the lumbar 4, 5, S1, S2, S3. Then sciatica nerve is going down. Then here sciatica nerve is dividing into branches. One branch going down, tibial nerve. One branch going on the side, peroneal nerve. So sciatica nerve dividing into parts. Sciatica nerve 2 पार्ट में बढ़ जाती है. एक पीछे चली जाती है जिसे टिबियल नर्व कहते हैं, और एक बगल में जाती है जिसे पेरोनियल नर्व कहते हैं. So that's why person is having pain here or the pain here. That is due to the sciatica nerve. So sciatica nerve is the having multiple divisions. So sciatica nerve is going supplying the lower part as well as the lateral part. So the branch of the sciatica nerve is also supplying the front part. So the feet is having a very deeper connection with the sciatica nerve. So the sciatica nerve coming from the back side, then it's dividing into part. One part going laterally, one part going on the back side, then it's go like this. The one part is supplying this part, one part is supplying this part and this part. So entire foot, sometimes foot pain is because of the compression of the sciatica nerve. Now this is the femoral nerve. Femoral nerve also supplying this front part, then going a little on the side and supplying little part of the foot from this side here. So what I want to tell you, these nerves, we are telling here femoral nerve, obturator nerve. On the back side, this is the gluteal nerve. Or here we are telling either the sciatica nerve or tibial branch of sciatica nerve. Okay, either the sciatica nerve or the tibial branch of the sciatica nerve. Okay, so let's see here the various muscles and their supply, various nerve and their supply. So look at here, iliopsoas means front side muscle, femoral nerve, rectus femoris, femoral nerve, sartorius, femoral nerve, and the tensor fasciae latae, gluteal nerve. Okay. Ultimately, these most of the nerve supply is why femoral nerve, because these are the muscles of front compartment. ये सारी की सारी जो मसल हैं वो हमारी फ्रंट कंपार्टमेंट की हैं. इस कारण से इनकी नर्व सप्लाई femoral nerve है. We can see in this image, these all are the muscles. Like this is the psoas major. The psoas major coming from the lumbar area, femoral nerve also coming from the lumbar area. Sorry, this is the psoas major muscle. This is the iliacus muscle, femoral nerve. Both together is also the femoral nerve. दोनों मिला के भी femoral nerve. Then we can see this oblique muscle, sartorius. That is also femoral nerve. Sometimes there is a compression in the femoral nerve causing medial side knee pain. हमारे घुटने के अंदर दर्द कई बार femoral nerve compression से होता है. Then this is the rectus femoris. This is also the femoral nerve. And this side muscle, the tensor fasciae latae, that is the gluteal nerve. Gluteal nerve is coming from the gluteal area. So ultimately, we have seen there are multiple nerves here and they are getting supply from the femoral nerve because these are the nerve of front compartment. Okay, so let's do the flexor movement and we'll memorize the femoral nerve. Okay, हम फ्लेक्शन वाली मूवमेंट करके फीमोरल नर्व को मेमोराइज करेंगे और फिर हम आगे बढ़ेंगे. Okay, so remember femoral nerve who is supplying the front body. Okay, so let's see here. ये पीडीएफ मैंने कई दिन पहले अटैच कर दिया है कोर्स में एनाटॉमी में. You can see there. Now femoral nerve is also coming from lumbar 2, lumbar 3, lumbar 4. Okay, femoral nerve also coming from there only, lumbar 2, lumbar 3, lumbar 4. So many times we are telling the femoral nerve innervation is lumbar 2, lumbar 3, lumbar 4. हम इसका जो इनर्वेशन है यानी कहाँ से प्रारंभ हुई, हम कहते हैं कि lumbar 2, lumbar 3 and lumbar 4. Okay, so let's do the flexion movement. Lie down in the supine, supine में लेट जाएंगे और हम femoral nerve को की एक्टिविटीज को देखें. So nerve are responsible who are connecting us with the brain, because brain is having central nervous system, then the peripheral nervous system. So nerve are going in the periphery and supplying the part. So that's why everything is happening under the order of brain. So let's start from the right leg, doing movement 10 times. So one, this is the flexion movement. Two, three, four, five, six, seven, eight, nine, and 10. This is the femoral nerve activity. Nerve is giving the message, and under the message of nerve, then muscle are getting this order. Without the nerve, muscle will not work. Doing from the other leg, one, two, three, four, five, femoral nerve, six, lumbar two, lumbar three, lumbar four, innervation, eight, nine, and 10. Wonderful. Now we'll do alternate movement of the flexion by using both the legs. Start now. One, femoral nerve, three, femoral nerve, five, femoral nerve, seven, femoral nerve, nine, femoral nerve, and 10. So femoral nerve and superior branch of gluteal nerve who is supplying the tensor fascia lata. Iliopsoas, rectus femoris, sartorius, these all muscle doing flexion movement. So there are four main muscle here: psoas major, rectus femoris, sartorius, and tensor fascia lata doing the flexion movement. Okay. So now if we are flexing our leg, holding from here, hold from here, do the Pavan Muktasana. And if you are not suffering with the neck pain, lifting the head up. Now doing the jig-jag up and down movement. Start to 1, 2, 3, 4, 10 times, 5, 6, 7, 8, 9, 10. Do the both side movement. 1. Wonderful back massage 2. In this condition, we have flexed our hip. हमने घुटने मोड़कर अपने हिप को फ्लेक्स किया है. We have flexed the hip, flexed the knee. 7, 8, 9, 10. Relax. Now bring the towel. Towel लेके आइए. Okay. So when we are doing the flexion, जब भी हम flexion करते हैं, these muscles are contracting. We are doing the contraction of these muscles. These muscles are shortening. ये muscles की shortening होती है. And the opposite side muscle are stretching, lengthening. Opposite side muscle lengthening होती है. Let's see this. We are taking the towel support. So now, in this stretching, so this is called passive stretching. Stretching with the external force. Now we are using the support of towel. So stretch your leg up, pull towards you. Now we can feel, because the flexure muscle are short and contracted, but we are doing the stretching of the opposite side muscle, and we can feel the clearly what is happening with the opposite side muscle. So pull it towards you till the 10 count. 1, 2, 3, 4. This is a flexion of hip. 5, 6, 7, 8, 9, 10. Now do from the other leg, lifting the leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Now doing from both the leg together. Now pull towards you. Pulling towards us. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax. So we have done the various flexion movements. Now again, bringing your leg up and holding toward the ceiling. अपने लेग को ऊपर उठाइए और सीलिंग की तरफ, ऐसा समझिए कि सीलिंग को आप होल्ड कर रहे हैं, छत को आप होल्ड कर रहे हैं. होल्ड फ्रॉम द थाई और द calf muscle area, from anywhere, and pull the legs towards you and stay in this position for a while. Hold anywhere. Don't bend your knee. Try to straighten your knee. Stay in this position for a while. Now gently lift your head up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Keep your head down and relax your leg. Relax your leg. Now doing from the opposite side, lifting the right leg up, holding from the thigh or calf muscle area, pulling towards you. Hold for a while. Now holding little up and lifting your head region, trying to bring your forehead as closer to as possible to the knee. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax both the leg. Now bringing both the leg up and folding from the knee. इस पोजीशन को होल्ड करिए. दोनों पैरों को ऊपर होल्ड किया और फिर बेंड कर लिया. Just be in this position for a while. It's a wonderful relaxing posture for your lower back area. Stay for a while. Now bringing your hands and keeping inside the knee like this. दोनों घुटनों में अंदर की तरफ लाइए और रख दीजिए. Now gently hold your feet. Now lifting the feet up, दोनों feet को ऊपर की तरफ, ceiling. Now keep the feet up like you are holding the ceiling. Now pull the feet downward. अब दोनों feet को, दोनों thighs को open up करिए. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Very good. Keep the feet down, just relax for a few seconds. After relaxing for a few seconds, now we can see the movement number next. So we have seen the flexure group of muscle, iliopsoas, rectus femoris, tensor fasciae, latae, sartorius. They are getting supply from the femoral nerve, and the tensor fasciae latae is getting supply from the superior gluteal nerve. Okay. Now we are moving to the next. Now extension movement. अब हम extension की बात कर रहे हैं. The extension of the hip is mainly done by two groups. Number one, gluteus maximus, and number two, hamstring muscle. एक तो gluteus है और दूसरा hamstring muscle है. Now we can see the gluteal is getting supply from the gluteal nerve, and all the other getting supply from the sciatic nerve. Sciatic nerve is the nerve of back compartment. So the tibial branch of the sciatic nerve. The sciatic nerve is coming from L4, L5, S1, S2, S3. So this tibial branch having supply L5, S1, S2. But just remember the tibial branch of the sciatic nerve. So hamstring muscle means the three muscle, biceps femoris, semimembranosus and semitendinosus. तो अभी हम extension of the leg की बात कर रहे हैं. We are talking about the extension of the leg. If you look at this image, this is the extension of the hip. We are taking the hip to the back side. हम hip को पीछे ले जा रहे हैं. There are two group of muscle here. One is the gluteus maximus, who is getting nerve supply from the inferior gluteal nerve, and other are the muscle that is hamstring muscle. These three group of muscle, 1, 2, and 3. These three muscle together are called hamstring muscle. These are the muscle of back compartment getting nerve supply from the sciatic nerve. इन्हें sciatic nerve की branch supply कर रही है, the tibial branch of the sciatic nerve. So there are three muscle. We know this is the biceps femoris. The middle one is the semitendinosus, and medial one the semimembranosus. We can see these all muscle are going till the knee. ये सारी की सारी muscle, look at the biceps femoris. ये biceps femoris है. It's ending on the lateral side of the knee. ये हमारे lateral side of the knee पर खत्म हो रही है. Then semitendinosus is ending on the medial side of the knee. We can see here. ये हमारे घुटने के medial side में जा रही है. And this semi membranous is also ending on the medial side of the knee. So it means the medial side knee pain might be the result of this problem. Sometimes there is a sciatic nerve compression and the person is having pain either in the medial side or the lateral side, depends which muscle is inserting there. So one muscle is going to the lateral side of the knee and two muscle going on the medial side of the knee. So we can understand now the knee pain is many times knee pain is not for the knee. कई बार घुटनों का दर्द घुटनों से नहीं होता, वो हैमस्ट्रिंग मसल से हो सकता है, साइटिक नर्व कंप्रेशन से हो सकता है. So when the patient is coming to us with the knee pain, first we have to try to understand what is the real root cause for the knee pain. So let's do the extension and we'll try to memorize two muscle. Gluteus is getting nerve supply from the different nerve. Hamstring is getting nerve supply from the different nerve. So let's see now. Do the extension movement now. अब हम extension movement करेंगे. Lie down in the prone. Prone में लेट जाइए. So extension movement, just lifting the leg up one by one. So let's start from right leg first. अब हम पहले right leg से start करेंगे. 10 times. 1, 2, 3. This is the extension of leg. 4, 5, 6, 7, 8, 9, 10. Relax. Doing from the other side. 1. Keep on doing. 2, 3. So gluteus muscle is getting nerve supply from the gluteal nerve. And this hamstring nerve is getting supply from the tibial branch of sciatica nerve. 5, 6, 7. Gluteal nerve, tibial branch of sciatica nerve, gluteal nerve, tibial branch of sciatica nerve, gluteal nerve, tibial branch of sciatica nerve. Relax. Now bringing both the hands, making the fist and keeping under the groin. As per the Yogasana concept, there are 3 asanas we should do in the sequence. Okay, bring your head, bring your both hands on the side of chest. अपने दोनों हाथों को छाती के बराबर ले आइए. So we will do the cobra pose. This is the first pose we should do before Salavasana. Lifting your entire body up, but navel should be on the ground, on the floor. Navel को lift नहीं करना. In the different asana, we also lift the navel, but in this, we are not lifting the navel. Cobra. And cobra is not taking the support of arm. Just lift your entire body up, like feel that you are a cobra and don't take support on the arm. Arm को ऊपर उठा लो. You are a cobra now. Bring the cobra-like feeling in your eyes. Bring the full energy in your eyes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. So this is the cobra pose. Now, interlocking the fist. अब दोनों fist को interlock करिए. Keeping on the back side of the head. Again, lifting your head up from the navel. Navel area will be on the ground. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Do yourself till you finish the 10 round. If you are not finished, then you complete, then relax. So this was the cobra pose or the bhujangasana. So in the 3 asana sequence, we do bhujangasana, salavasana and dhanurasana. Means cobra pose, then salavasana, then dhanurasana, bow pose. So now we'll be doing the salavasana. So making the fist and keeping under the groin. The very good point. In the Jinsen Jutsu, this point is called the laughter point. Who is making your heart in very good condition? So keeping your both hands here. Now, lifting the any one leg up. Let's start from the right leg. Start. We can keep the chin over the ground. 10 rotation, 10 extension of the hip from the right leg. Start. 1, very slowly. 2, 3. We are using the gluteus muscle, gluteal nerve. We are using the hamstring muscle, the tibial branch of sciatic nerve. Gluteal nerve, tibial branch of sciatic nerve, or the inferior gluteal nerve, tibial branch of sciatic nerve, inferior gluteal nerve, tibial branch of sciatic nerve, inferior gluteal nerve, tibial branch of sciatic nerve. Keep on doing till you finish the 10 movement. Now doing from the other side, start. 1, 2, 3, 4, 5, gluteal nerve, tibial branch of sciatica nerve, inferior gluteal nerve, tibial branch of sciatica nerve, inferior gluteal nerve, tibial branch of sciatica nerve, and inferior gluteal nerve, tibial branch of sciatica nerve. Relax. Now lifting both the leg together, then hold for 10 count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax for a while. Release your hands. Ready for Dhanurasana. Bending your both knee. Holding the ankle by the hands. Now inhale and lifting your head and leg up. Now normal breath. Very good. Pose. In the sequence of 3 asana, Bhujangasana, Salavasana, Dhanurasana, we should always do these 3 asana in the sequence. First do Bhujangasana, then do Salavasana, then the Dhanurasana. The combination of all 3 is really very good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. We'll do once again. But you relax for a while. थोड़ा रिलैक्स करिए, फिर हम थोड़ी देर में पुनः करेंगे इसी को. Now inhale and lifting up. Now do the front and back if you can do. Otherwise, just hold the position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax. So we have done the extension of the knee, extension of the hip, and we have activated our muscles. That is gluteus maximus and the hamstring muscle. Hamstring muscle is a group of 3 muscles: biceps femoris, Semimembranous tendinosus, semimembranous. The nerve supply from the inferior gluteal nerve to the gluteus maximus, and for other three muscle nerve supply from the tibial branch of sciatic nerve. तो हमने हेमिस्टिक मसल को एक्टिवेट कर दिया। हेमिस्टिक मसल को टिबियल ब्रांच ऑफ sciatic nerve सप्लाई करती है और ग्लूटियस मैक्सिमस को इंफीरियर ग्लूटियल नर्व सप्लाई करती है। लेट्स मूविंग टू द नेक्स्ट। Now we have done the extension. Now we are going to the abduction. Abduction mainly done by three muscles: gluteus medius, minimus and tensor fascial lata. एबडक्शन मुख्य रूप से तीन नर्व के द्वारा होता है: gluteus medius, minimus and tensor fascia lata. And we can see here all the gluteal muscle are getting nerve supply from the gluteal nerve. All three muscles are getting nerve supply from gluteal nerve: superior gluteal nerve, L4, L5, S1, superior gluteal nerve, superior gluteal nerve. ये तीनों के तीनों मसल्स को सुपीरियर ग्लूटियल नर्व सप्लाई करती है। ओके, so we can see here in this image how this muscle, these three muscles are very important. So now we can see here, this is the gluteus medius. We have removed the maximus. The top one will be the maximus, but in this image the top one is absent. So this is the gluteus medius, and if we remove the gluteus medius, then we'll see the gluteus minimus inside. अगर हम इसको निकाल दें तो ये मिलेगी हमें, ये gluteus minimus and the tensor fasciae lata. All three together are doing the movement of hip abduction. We can see this is the hip abduction. Hip को ले जाना, the nerve supply from superior gluteal nerve. Okay. Now we can see here this tensor fascial lata is having connection with the lateral side of the knee. Sometimes tensor fascial lata is becoming tight with many runners, जो लोग रनिंग की प्रैक्टिस करते हैं या एथलीट्स होते हैं. Sometimes their tensor fascial lata is very tight and they are having knee pain on the lateral side. Okay. So let's do this movement. चलिए इस movement को perform करते हैं. And we'll remember three muscle: gluteus medius, minimus and TFL. So let's start. Hip abduction. Hip abduction. So lie down on the sideline. Sideline में लेट जाइए. Now gently lifting the leg up. This is the hip abduction. 1, 2, 3. This movement is done by tensor fascial lata and the gluteus medius and minimus. Gluteus medius, minimus are here in the side only, little side. It is going like this. 6, 7, 8, 9, 10. Relax for a while. We'll repeat the movement once again. Relax for a while. Start once again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax for a while. We'll do one variation once again. Now lifting the leg to 30 degrees and just rotate your hip here only. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do the opposite. 1, 2, 3, 4, 5, 6, 7, 8, 9. If you have not finished, kindly complete. Complete. If you do only 5, then you get tired. Then repeat once more and complete the 10 round. So this was the abduction. For the abduction, there are 3 muscles: gluteus medius, gluteus minimus, and the tensor fasciae latae. All 3 getting nerve supply from superior gluteal nerve. Let's do from the other side. अब हम दूसरी ओर से करें. Hip abduction from the other leg. Lie down and make yourself ready for doing from the other side. Just relax for a while. First, we'll start hip abduction. Start now. 1, 2, 3, 4. Gluteus medius, gluteus minimus, tensor fascia lata. Gluteus medius, gluteus minimus, tensor fascia lata. Superior gluteal nerve, superior gluteal nerve. Relax. Relax for a while. We'll repeat the action once again. Start now. 10 rounds. So superior gluteal nerve supplying to gluteus medius, superior gluteal nerve supplying to gluteus minimus. Keep on doing. Do 3, 4, gluteus minimus, gluteus medius, and tensor fasciae lata. All 3 getting nerve supply from the superior gluteal nerve. Superior gluteal nerve, superior gluteal nerve. Keep on doing until you complete the 10 rounds. Relax. Relax for a while. We are lifting the leg up till the 30 degree. And now we'll be doing the movement here. Start now. Movement just by the hip. No need to do this much. Just a little bit. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Doing opposite direction. Complete as per your speed. Relax. Complete your 10 rounds. We are waiting for you to complete. Relax. Lighten the supine. Relax. When you, after the few seconds, you can come on the screen. So let's do the next movement. Now adduction. Adduction means bringing the legs back. That is called adduction. Adduction मतलब अपने hip को add करना. We can see the three muscles here. Adductor group of muscle. Because these muscles are located inner side. So nerve supplies obturator. Obturator. The three muscle adductor magnus, adductor longus, adductor brevis. All the three muscles are located inside. The magnus is obturator and the sciatica. The longus is obturator, brevis is obturator. So we have to remember obturator. हमें obturator हमने आपको बताया था अंदर को obturator सप्लाई करता है. We have divided in three parts. Front is femoral, back is sciatica, and internal is obturator. So we can see here these are the muscles, adductor group of muscle. They are doing adduction. ये adduction कर रहे हैं. So we can see this is the adductor longus, which is getting nerve supply from the obturator nerve. This is the adductor magnus, which is also getting nerve supply from the obturator nerve. And the one muscle hidden inside एक muscle है जो पीछे की तरफ छुपी हुई है. This is the adductor brevis. So adductor brevis is doing the. So we can see this the movement. ये movement है. The movement of hip adduction. ये movement है जिसे ये three muscle मिलके कर रही, right? So in this way we can see this movement. Hip adduction. The nerve is obturator. Nerve कौन सी nerve supply कर रही है? उस nerve का नाम है obturator nerve, right? Obturator. So let's see and do the movement here. Again we'll take the support of towel for adduction. हम adduction करेंगे. So for the adduction we will take the support of towel. So lie down, keeping the towel in the center and squeezing both the leg. So the internal muscle are in the huge and these muscle are getting nerve supply from obturator nerve. So keeping the leg inside like this, in between the thighs. पहले हम thighs में करेंगे फिर हम knee में करेंगे. So let's start from the thighs. Lie down the supine. Now squeeze the towel 10 times with full force and every time stay for a while. हर बार जब आप squeeze करें 1 second तक रुकिए. See, 1, 2, 3, 4, 5. Adductor group of muscle supplied by obturator nerve. Adductor magnus, adductor longus, adductor brevis. All three muscles are getting nerve supply from obturator nerve. After completing 10 rounds, just relax for a while. थोड़ा आराम करिए और टॉवल को घुटनों के मध्य में रख दीजिए. Keep the towel in between the knees. Again, we'll repeat the 10 movements. Start now. 1, squeeze the towel. 2, obturator nerve, obturator nerve, obturator nerve for adduction, obturator nerve for adduction, obturator nerve for adduction, obturator nerve for adduction, obturator nerve for adduction. Keep on doing the movement of adduction. Adduction को करते जाइए. Relax for a while. We'll repeat once again the entire two movements. Keeping the towel once again in between the thighs. टॉवल को फिर से थाई के मध्य में स्थापित करिए, रखिए. Now squeezing the towel, start now. 1, 2, adductor magnus, adductor longus, adductor brevis, all supplied by obturator nerve. Adductor magnus, adductor longus, adductor brevis, all supplied by obturator nerve. Adductor longus, adductor magnus, adductor brevis, all supplied by obturator nerve. Relax for a while. थोड़ा रिलैक्स करिए. फिर टॉवल को घुटनों के मध्य में रख दीजिए. And repeat the action once again. 10 repetition. Start now. 1, 2, 3, 4. With full force. 5. And hold for a while. 6, 7, 8, 9, and 10. Relax. Relax for a while. This was the adduction. ये हमारा adduction था. In the adduction we are using the adductor group of muscle. हम इसमें adductor group of muscle को use कर रहे थे. So now we are moving to the next movement. हम अगले movement की तरफ आगे बढ़ रहे हैं. So that is the movement of internal rotation. Internal rotation is done by gluteus medius, minimus, and tensor fasciae lata. Just we have discussed. Supplied by superior gluteal nerve. तो इसको मैं दिखा देता हूँ. ये जल्दी हो जाएगा आपका. So let's see this movement now. इस movement को देखिए. If you look at this movement, this is the internal rotation. How the hip is coming to the medial side. This is called medial rotation or internal rotation by the tensor fasciae lata, gluteus medius, and the muscle inside minimus. तो चलिए ये मूवमेंट परफॉर्म करते हैं. लाई डाउन इन द साइडवर्ड लेट जाते हैं. सो फर्स्ट विल डूइंग द मूवमेंट ऑफ एबडक्शन. पहले हम एबडक्शन करेंगे. When we are doing abduction, the same muscle we are using, gluteus medius, minimus, and tensor fasciae lata. हम उन्हीं मसल का प्रयोग करते हैं. The same muscle we are using for internal rotation or the medial rotation. Okay. So we'll do both movement together to memorize abduction and internal rotation. Okay, do 1 abduction and medial rotation. 3 abduction and medial rotation. 4 abduction and medial rotation. Keep on doing till the 10 counts. Gluteus medius, minimus, and tensor fasciae lata. Gluteus medius, and tensor fasciae lata. Gluteus medius, minimus, and the tensor fasciae lata. All three getting nerve supply from the superior gluteal nerve. Keep on doing till you complete the 10 rounds. You can feel the clear sensation here. Relax and lie on the supine. इसी मूवमेंट को अब हम सुपाइन में करेंगे, बट इन डिफरेंट. इन द सुपाइन जस्ट वी आर डूइंग इंटरनल रोटेशन. हम केवल इंटरनल रोटेशन करेंगे. सो जस्ट फोल्डिंग योर लेग्स टू द इनर साइड. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 racks. Going to other side, doing from the other side. First we'll do abduction. This is done by the gluteus medius, minimus and tensor fasciae latae, and internal rotation. 2 abduction, internal rotation. 3 abduction, internal rotation. 4 abduction, internal rotation. 5 abduction and internal rotation. 6 abduction and internal rotation. Keep on doing. Gluteus medius, minimus, tensor fasciae latae. Keep on doing. Nerve supply by the superior gluteal nerve. When you complete the 10 rounds, just lie down the supine and just doing internal rotation. Do it now. 1, 2, 3, gluteus medius, tensor fasciae latae, superior gluteal nerve. Gluteus medius, gluteus minimus, tensor fasciae latae, superior gluteal nerve. Gluteus medius, gluteus minimus, tensor fasciae latae, and superior gluteal. So this was the internal rotation. Now the final and the last movement of today, that is external rotation. अब हम external rotation देखेंगे the last. So finally, we have reached to the external rotation. The external rotation is done by many muscles. If you remember, we have discussed the 7 group of muscles, 7 muscles. हमने बात की थी कि 7 मसल हैं जो एक्सटर्नल रोटेशन करती हैं. They do the lateral rotation of the hip. Okay. So if we see the lateral rotation of the hip, so look at first this image. So this is the lateral rotation. When our hip is going to the lateral side, that is called lateral rotation of the hip. It's a hip का lateral rotation कहते हैं. So this is the muscle that is gluteus maximus. Who is doing this lateral rotation? जो ये lateral rotation कर रही है. If we remove the gluteus maximus, then we'll see the other muscle. This is the piriformis. Piriformis is very common muscle. Sometimes it get compressed and people are suffering with the sciatica pain. ये हमारी बहुत important muscle है जो lateral rotation करती है. The piriformis. Then we can see these muscles. How these other muscles are doing contraction. This is called superior gemellus and inferior gemellus. ये दो gemellus muscle है, superior gemellus and inferior gemellus, they are doing external rotation. Then this is the obturator, externus and internus, and last is the quadratus femoris. This is the quadratus femoris. How many muscles we should remember? We can remember this quadratus femoris. We can remember the piriformis and gluteus maximus. हम 3 muscle को याद रख सकते हैं. Piriformis is very important. So these are the 7 muscles who are responsible for doing the external rotation, जो हमारा hip का external rotation करती है. Now look at in this image. Now look at in this diagram. So we can see here, if the obturator internus and the obturator externus muscles, they are getting the nerve supply from the obturator nerve. अगर obturator muscle नाम है, तो nerve supply भी obturator होगी. Got it? The superior gamellus and the inferior gamellus is also getting nerve supply from the obturator internus muscle. But there is one another nerve, that is quadratus femoris. Here we have to remember the piriformis. Piriformis is from S1, S2, okay, and the quadratus femoris is the nerve of quadratus femoris. So the three muscles are just, if you can just go through once, if not just go through once, that if someone is think you are reading somewhere the nerve to quadratus femoris, you should remember, yes, this is the nerve, some nerve. Okay, so these are the nerves. We should remember the movement, okay, and accordingly we'll move. So now this is the final movement we are doing here. Yes, Sarabjit ji, quickly. अभी हमारी एक मोमेंट बाकी है या
तो मेरा लास्ट में ले लो क्वेश्चन।
नहीं, अभी बोल दो क्या है।
सर वो पीनेस्टी की वीडियोस बराबर नहीं है, मैं मेनी वीडियोस आर मिसिंग।
मैसेज करिए ग्रुप में।
किया मैंने सर।
ठीक है, ओके, विल करेक्ट इट, या श्योर। So the final movement we will do. So now we are doing external rotation of the hip. Okay. So lie down, and what is external rotation? Just taking the leg to the lateral side. This is the external rotation. 1, 2, 3. Keep on doing. 4, 5, 6, 7. 7 muscle. 8, 9, 10. Doing from the other side. 1. Gluteus maximus. 2. Superior gemellus. Inferior gemellus. Obturator externus. Obturator internus. Quadratus femoris. Piriformis. The main muscle piriformis who do the external rotation. If possible, just remember the piriformis muscle. Lifting the leg up, पैरों को ऊपर ले जाइए. Then bringing to the lateral side. This is also external rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Doing from the other leg. दूसरे पैर से करना है. Lifting the leg up and doing the 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. You have done. Just after completing my class, just take the 10 minutes savasana. Then you do your work. क्लास कंप्लीशन के बाद 10 मिनट शवासन करिए, फिर अपने काम के लिए निकलिए. So let's close the session. See you tomorrow. अब हम कल मिलेंगे. Thank you so much. Have a wonderful day. Closing the session now.